Sounds good.
So, all right, guys, everybody about ready? We're going to go in about 30 seconds or so.
Okay.
All right, Monica, we will go in 10, 9, 8, 7, 6, 5.
Hi, everyone, and welcome to WKYC's Town Hall Forum on Mental Health. I know if you're in the pandemic like we are, everybody is having issues. You are certainly not alone. And we have a number of experts here that you can see who are going to answer some of your questions as best they can. And I want to introduce to you who our experts are. They are all from the Cleveland Clinic. I'm going to start off with Dr. Veena Ahuja. She's a child and adolescent psychiatrist. Say hello, Dr. Ahuja.
Hey, everyone.
And I have Dr. Donald Malone Jr., chair of the Department of Psychiatry and Psychology at Cleveland Clinic, director of the Center for Behavioral Health. Hey, Dr. Malone. And we have Dr. Ethan Benor, head of Cleveland Clinic Children's Center for Pediatric Behavioral Health.
Hello, thanks for having me.
And we have Dr. Gerard Benez, who is a pediatric psychologist. Thank you all so much for joining us today, because we have a ton of questions that I've been receiving all day and for the past few days. The first question I got, first of all, before I do that, I want to encourage everybody, if you do have a question for our panel, please text them. You can text the question to 216-344-3300. And what I'd like to do first is let each of our panelists kind of give you a little bit more background on who they are and what their specialty is. So if you have a question for a specific doctor, you'll know who to ask it for, or basically all of them can answer any of your questions on mental health. Dr. Ahuja, let me start with you. Can you give us a little bit of background on you?
Sure. So I work as a child psychiatrist here at Cleveland Clinic. I've worked with the Center for Autism and our pediatric pain program. And then I also work on main campus and on our inpatient unit. So we've got a lot of different populations that we cover. I'd say the majority of my patients are a lot of patients that are on the spectrum or have special needs. So that's kind of my primary focus.
Dr. Malone, tell us about you.
So I've been at the clinic for 31 years. I'm chair of adult and child psychiatry at the Cleveland Clinic and president of Lutheran Hospital, which has a large behavioral health footprint. Most of my research and my clinical work has been with mood and anxiety disorders.
All right, Dr. Benor.
Sure, so I'm head of Center for Pediatric Behavioral Health. Clinically, my focus is on a headache or other pain conditions, concussion as well, but a primary focus has been sleep, both in younger children and older children.
And Dr. Benez.
So I am a clinical child and pediatric psychologist. I direct our pediatric pain rehabilitation program. I have a special interest in behavioral health and wellness, health promotion, and prevention interventions for mental health.
And I would be remiss if I don't introduce us to Dino. Of course, Dino is a very familiar face at Channel 3. He is in charge of WKYC.com. He's one of our producers. He does sports. He does everything. And Dino, you also shared your personal story about your dealings with mental health. You want to talk a little bit about that?
Yeah, about 2 years ago, we put together a story at WKYC.com with Russ Mitchell, your help, Monica. A lot of people helped to talk about a lifelong journey in a battle with depression and anxiety that kind of culminated or really climaxed, I guess, about 4 years ago this month when, you know, I was a patient at Dr. Malone's hospital at Lutheran for 3 or 4 days. And I was telling Dr. Malone before we started, they were 3 or 4 of the most life-changing days of my life to deal with my depression, deal with what I'd been going through. And it kind of culminated with an anxiety attack. And I've tried to be an advocate since then for mental health. So I was pleased to be asked to assist tonight. And yeah, we are monitoring both our text line at 216-344-3300, and also here on Facebook and YouTube. If you've got questions throughout the show, we'll be monitoring them and letting the doctors get a chance to answer.
All right, I wanna start though with one that we just got in recently. How can you tell the difference between normal mental stress and emotional stress and hormonal imbalances? I'm just gonna throw that out there, but Dr. Malone, I think this one is targeted to you.
Yeah, I mean, there's a lot of reasons why people will get depressed, or there's a lot of reasons why people will get anxious. Some of those can be medical and can be influenced by hormonal changes, particularly in women, or other kinds of different changes in the body, whether your thyroid's off or other kinds of things. So there are medical reasons. But most of the time, when people are suffering from depression or anxiety, it doesn't have an obvious medical cause to it. And so, but it is a medical illness. There's no question that mental illnesses are medical illnesses. And we have very effective treatments for them, whether it be medication, whether it be psychotherapy. There's a lot of different interventions that we can have that can be very successful.
One of the things most of you have noticed, we have 3 experts in pediatrics. So I want to kind of turn the attention, especially if there are parents out there. This is where you kind of want to focus, because I'm sure all of you are going through one thing or another and you're not alone. So Dr. Benor, I'll throw this out to you. My child is not getting enough time with her teachers, and teachers seem so distracted with the tech issues of this virtual learning. What can I do?
That's a very good question. So it's a difficult time right now. It's a difficult time for everybody, I'll say. The teachers, they've really had to rally, adjust to a school environment, which they might not have even known until the last minute whether they were doing in-person, virtual learning. The kids have had to struggle with this. I think there's a key issue is that I think one thing that teachers are trying to do is create a sense of structure, create a sense of normalcy as best as they can, focus on some education. And there is some benefit to that for children, having a normal structured routine, getting back into talking about something other than COVID, other than a pandemic. At the same time, children are going to school, wearing masks, wiping their hands down, everything, having assigned seats, being physically distanced from each other. It's hard not to talk about it. And so it's important, I think, for teachers, you don't have to have a long conversation about it, but just to verbally touch base with the kids, whether it's in a group and even one-on-one with kids. Ask them how they're doing, let them know that you care. Just that short one-on-one, I think, will help kids know that even though we're trying to get back to education, there is still a focus on how they're doing emotionally during this time.
I can't imagine how many parents are talking to you about virtual learning. How is that impacting in general? We've heard a lot of comments about people are worried about their kids being at home and not being around their friends, not being in those social settings. Are you getting those questions from parents? Is that a real concern that people have to worry about?
Well, it's definitely a real concern. And I think there are some individuals who are doing better than others. Certainly the age of the child influences how virtual learning looks at home. I mean, there's been recommendations for having a private workspace and set times when they're going to be working. But there are technology issues for individuals, having multiple children, even younger children, trying to work online. It's very difficult for a parent to manage 3 different children at different ages at the same time. You shrink the house down, and that makes it even harder. So very difficult to focus. And you add to that 1 in 5 teenagers really are unable or struggle completing schoolwork just because of poor internet connection. And then, African-American children, Hispanic children, children from low-income families are disproportionately affected by this. And so it's important for school systems to try to reach out and provide as much support as they can for these individuals, because it's not easy what they're going through.
And if I can just If I
Please.
could just add here, I think this is one of these issues where what makes COVID so stressful is that it has changed so much in our daily lives. Nothing is at all the way we are used to. The things aren't the way we want them to be. And this whole, the virtual learning issue is a big issue. It's a huge one. And I think this is one of these where we need to all be patient with one another. Parents with teachers, teachers with parents, parents with kids. This is all new to us. We're learning and everyone is trying to do best. And I think that if we can be patient and supportive of one another, it will go a long way.
This is a question, I think, Dr. Ahuja, this one is for you. It just came in on our tip line. How can I explain this pandemic to my sister who has Down syndrome? She wants to know when it will end.
Yeah, and that's a really tough one. So, working with a lot of kids that have special needs, I think it's incredibly difficult. We know most kids with special needs don't deal well with unexpected changes. They don't deal well with not being able to know what's going to happen next. They don't deal well with having to do things without preparation. So I feel like COVID's kind of brought up all of those difficult pieces. I think it's important to kind of focus on what the patient or child or your sister is kind of worried about. So the biggest things that kids are worried about is, am I going to be safe? Is my family going to be healthy and okay? Like, what is school going to look like? Or can I go to the park? Can I play with my friends? So I think focusing more on kind of the concrete pieces of what they're able to do really helps. So maybe explaining, we can't, go to a big birthday party or we can't go to a crowded restaurant. Instead, why don't we try this, and really focusing on what we can do during that time to kind of draw attention away from it. And I think there's kind of a variation. So really young kids may not understand at all what's happening, or kids with lower functioning may not understand. And then there's young kids who do understand but are too young to deal well with it, like 8 to 9-year-olds may understand but not understand enough to be reassured. And then we get into the older kids. So I think it really depends on what your child understands, what your family member understands, and just focusing on what can we actually do right now instead of focusing on what we're not able to do.
We got another question in, and this one I'll throw out to all of you. How do you know when you are experiencing a dangerous level of stress and or anxiety?
Well, dangerous can mean a lot of things. I think that a real signal is when you're not functioning the way you used to function, whether that's with your family, whether that's at work, whether it's in any kind of different situation. If you're not functioning, if it's impairing your abilities, that's a signal that things are getting bad enough that you really should get help for that. Obviously, the ultimate danger is somebody who becomes suicidal. And there was a survey done by the CDC that noticed a significant increase in suicidal thinking during the COVID pandemic. This was done at the end of June. And it's 11% of the population had seriously thought about suicide in the preceding 30 days. And it was double that in the 18 to 24-year-old population, double it. Those are staggering and stunning numbers that really are much higher, at least double, if not 3 times higher than they were prior to the pandemic. So we know people are suffering. We also have noticed in our emergency rooms, we saw a 60% decrease in the numbers of patients we had coming in with suicidal thinking. So not only is it much worse out there and much more common, people are seeking help much less often. And that is a dangerous combination.
So here, another question we just received. How do you know when a family member with a diagnosed mental illness, or what do you do rather, when a family member with a diagnosed mental illness doesn't seek help? What options?
That's really hard. If they're really a danger to themselves or other people, then you need to get somebody involved, whether it's calling police or anything else. But short of that, most people are short of that. And it is a difficult conversation. I think honesty is always the best thing. Here's what I'm noticing. Here's what I'm seeing. And this is why I'm so concerned. And if you've had problems yourself, that's even better, because you can say, here's my experience. Here's what I've done. like what Dino shared before, that is so powerful when you're talking with somebody else who's suffering.
Dr. Bennis, I'm thinking this one might be for you. Can anxiety cause physical ailments or make you believe you're having physical ailments? I know I've had a panic attack personally, and I thought I was having a heart attack. Can it do that?
So we know very well that psychological factors like stress, your mood, your emotions can play a huge role in how you feel physically. So both Dr. Benor and I do a lot in the area of pediatric pain. And we know that when people are stressed out, their pain feels worse. When they're in a bad mood, it's harder to cope with their pain. When they're sad, when they're angry, when they're worried or anxious, it makes it more and more hard to function with pain. So clearly those factors, and specifically to this question, anxiety can play a role in the development and maintenance of physical problems. And we also know that there are pain-specific anxieties or health-related anxieties, so that on top of the physical ailment, you have the anxiety, which just makes things worse. Patients will awfulize or catastrophize, which makes things even harder to treat. In those cases, addressing those psychological factors is a huge part of the treatment for these patients.
This next question is, it's kind of why we're actually doing this entire forum right here. What should the medical community and media do to combat the stigma of mental illness in our society? Because I'm wondering, are you guys seeing that even though it's a pandemic, and you even brought this to point, Dr. Malone, that people are still reluctant to get help? And what we're trying to tell everybody is you're certainly not alone.
You know, I think going back to something that Dr. Benez said earlier, it's not so much about mental health or mental illness. It's about wellness. This is a global pandemic. Everybody is struggling at some level right now. It's very important to check in with your neighbor, to check in with your family member, to reach out for what resources that we have. The more that we're openly talking about these issues and showing some compassion for each other, I think the more people can reach out. One of the things, and I appreciate you hosting this, but having this conversation and making sure that people are having the conversations. How are you doing? How are you feeling? Check in with your loved ones. What do you notice and how are they feeling? Start the conversation and you can build from that.
This, I'm going to throw another one in here because I've been getting a lot of questions about this, but my loved one is in a nursing home and we haven't been able to see her, and I'm worried about her losing the will to live. What can I do? Now, we do know that Governor DeWine just said today that he's going to open nursing homes, you know, as the weather gets worse because people can't go outside to see their loved ones. But I'm hearing this over and over again, how people are so concerned about their loved ones in nursing homes, and the fact that even with the iPad or the iPhone or whatever they're using to do the virtual visits, it's still not enough.
No, there's no playbook for this, right? It's, you know, this is new. And we want to hug our loved ones. We want to be around them. We want to hang out. We want to sit on the bed with them at their nursing home, right? And it is a challenge, and there is no good answer. There is no great substitute for that eye contact, for that one-to-one interaction. There just isn't. And so I think the conversations over the phone, the iPad conversations, are a substitute in some ways, but they're not what you would like to have. One of the things that I've seen other people do is every day they'll send a picture, you know, some kind of a family picture, or some kind of a memory, if you will, to the iPad or to the phone, and it just brings back those pleasant, kind of happy memories that people have. But ultimately, it's going to be important to go back and to really engage with family, and it's just it's challenging.
And, and I would share the ideas. I would post it on social media. When we started this pandemic, the idea of the elbow bump came up. People started doing, outdoor window visits. And a lot of that was being posted on social media, and it was helpful. It gave people a sense of hope, that an idea that I hadn't thought of yet. And so I think I agree that there's no playbook, but by sharing some of these ideas, we'll come up with what feels like best practices or what seems to work for us and our family.
This next question is a little specific, and I'm not sure who wants to take this one, but can you discuss ECT and ketamine and their effectiveness for treating resistant depression?
I can. We actually have a very large study going on right now looking at ketamine and ECT at Lutheran Hospital. ECT has been a very effective treatment for severe depression for a very long time. And it's something that we do use in individuals that are suffering from severe levels of depression. Ketamine's still early in its study. It does seem to have not too severe side effects and the potential for antidepressant effects, but we still have a little bit of research to do with it to know where it's most effective.
I think you and I did a story on that not too long ago, if I'm not mistaken.
We did.
All right, how can children who are virtually learning and worrying that they're lagging behind because they're not getting direct instruction fight through this stress?
I'll take this one. So one thing, I'd actually read this from another psychologist that I thought was well said, which is everybody is struggling right now. And so if your child is struggling, your child is not the only child that's struggling. If your child is lagging behind, your child is likely not the only child that's lagging behind. Look, this is going to be a difficult year. It's going to be a difficult school year, but we will manage to get through it. In the meantime, I think what you can do, reach out, talk to the teacher for any additional supports that you can do. Try to provide some sort of reassurance to your child as well. And the other thing that I've been encouraging the parents that I talk to is this is a great opportunity for you as a parent to kind of step up and assist in education as best as you can. They're going to need more from you from an education standpoint than maybe they did last year, not just to advance academically, but also just to manage the emotional stress of the workload.
Here's another one, and I can relate to this. There seems to be a lot more fighting at home now. Everyone is at their wits' end, and I'm trying to support my child, but her behavior is out of control.
When I saw this question earlier, when it came up and we previewed some of the questions coming in, and I think all of us can relate to this. Everyone is being affected by this. Kids, parents, friends, supports. And for the longest time, we were all together under the same roof, trying to do what we normally do. And that made things even more stressful because each of us was trying to handle our own daily hassles. The things I think about here are the importance of good communication, openness, honesty with one another. The family check-ins can be especially useful. I think, especially when all interactions seem like they're negative, making time for some positive family interactions so family members can experience themselves in more